Ashley Bloomfield, Director General of Health, thanks so much for joining us this morning.
Kia ora, good morning, Luke. Welcome.
First thing, what can you tell us about the case that was discovered in MIQ yesterday, stuff broke the news about? Where are we at? What's going on?
Well, nothing really further overnight. We know we've got this case that as a person who arrived from Germany on the 10th, the positive test was at that day 0, day 1 test that we do on all arrivals. And of course, they're not allowed out of their room until that test returns negative. So that was picked up and the person was then moved to quarantine. But all the people on that flight, and I understand quite a number of them were transferred to 2 hotels in Christchurch, and I've also learnt there are some who are in a managed isolation facility in Auckland still. All the people on that flight now considered as close contacts, and they were already on that day 1, day 3, day 6 testing regime. So we'll be looking closely just to see if there are, any other infections on that flight.
So all of that cohort wins their next test?
They'll have had their day 5 tests and we'll be expecting, or day 5, 6 tests. So we got some of those results yesterday and there'll be more coming through today. So we'll have an update and know whether there are other cases on that flight. I should say that there is another case already we know on that flight from the earlier testing, but it was separate. It was a Delta variant of the virus, so it was just a coincidental case that was on the same flight.
Now, obviously, since we moved into the traffic light system, updates on new cases have been pulled back. Yesterday, you gave a briefing, you were talking to media this morning. How concerned should the New Zealand public be leading into Christmas about this new variant?
Well, the first thing I'd say is just to reiterate that this case we've found is in managed isolation and quarantine, and our managed isolation and quarantine has served us incredibly well as a country through this pandemic, and hundreds of Delta cases, which we know was a lot more transmissible than earlier variants. Hundreds have been found in MIQ. We've had that one incursion. We still don't know exactly how it happened. And of course, we're now really right around that outbreak and in a good position, especially with our high vaccination rate. So people should be just alert and also, doing the things that we're expecting them to do this summer. But our high vaccination rate is very protective. Our public health measures, the infection prevention control in our managed isolation facilities is very good. But also our classic testing, isolation, contact tracing, where we've seen, even when we've had cases spread from Auckland over the last few months, we've been able to get around them quite quickly. And you look at Northland especially, which has had a number of cases pop up. The team's done an amazing job up there of getting around those and containing those. And we're going to keep doing that through summer. Now,
how infectious is this compared to Delta, when Delta first arrived into the community in New Zealand? Because obviously we had a much lower vaccination rate there. It was quite infectious, whereas this is more infectious than Delta, but of course 90% vaccination rate that was sort of officially declared yesterday.
Yeah, a couple of things there. First of all, we're learning from Europe especially, and also watching New South Wales closely, that this variant does seem to be quite a bit more transmissible than even the Delta variant. And we're seeing high rates of onward infections in households and in sort of those close contact settings, some quite amazing high rates of onward infection. But I think the second thing is, and this goes to the point about vaccination, is we're getting emerging evidence that it seems that, first of all, the Pfizer vaccine does afford protection against this variant, which is great, but that 3 doses seems to be the level that gets that protection right up in the 80s, again, 80%. And so we're looking very carefully and talking today with ministers about whether our 6-month interval for the booster might be reduced.
So you're providing official advice on that today,
That's exactly right. Our technical advisory group looked at that this week, and I think there are 2 things. There's that emerging evidence about 3 doses providing a good level of protection against Omicron. Again, that's reassuring. But secondly, we want to be going into winter with maximum population immunity. And if the interval's 6 months, we've found so far about 50% of people are booking in and getting that 6-month booster at the right time. So we don't want a delay, 8 or 9 months, and it may well be the shorter interval will just ensure that we've got through people ahead of winter.
And what does the research suggest about interval length if you're going to cut it back from 6 months?
I think that's not so much a research-based decision as a sort of a pragmatic and an operational decision. And again, it's thinking, and we're looking hard at this, how do we get ourselves into winter with the highest level of population immunity? And of course, the other aspect of that is the decision by MedSafe to approve or provisionally approve the paediatric version of the vaccine for our 5 to 11s. So again, we're working very hard to get that advice through to ministers to get a decision, and if that decision is made to start the program for 5 to 11s, then that brings in another big portion of the population who we can offer immunity.
When do you expect that to start?
Well, we've already said that if the decision is taken, we will be starting that program before the end of January next year.
So 5 to 11-year-olds before the end of January next year. Advice on reducing the 6-month wait time for boosters, going to Cabinet today. Just to step back and slightly more broadly, one of the interesting things to have a look at some of the evidence from overseas is the extent to which, I guess, the vaccine means that hospitalizations are to some degree decoupled from overall case numbers. What can you tell us about, in other words, you can have an explosion in case numbers, but your hospitalizations, don't explode in the way that they would have prior to the vaccine. What can you tell us about how Omicron behaves in that regard, and how well and how the evidence is shaping, and how well New Zealand is set up to do that?
Well, of the emerging evidence around Omicron, this is the area where we know the least at the moment, and so we're watching carefully what's happening in Europe and also, again, New South Wales. Because in New South Wales they've got sort of parallel Delta and Omicron outbreaks, it will be really interesting to see what the illness severity and hospitalisation rates are comparing the two. But what I would say, of course, is that your hospitalisation numbers will be driven by two things. First of all, the rate of the seriousness of the illness. And even if it's half as serious, if there are 10 times more infections, then the number of hospitalisations will be high. And so it's looking at both the transmissibility and that sort of illness severity. But in terms of illness severity with Omicron, it's the area we know least about at the moment, but within the next week or two, I think we'll start to get some much better information on that.
And I'll preface this by saying I understand that this is obviously ultimately a Cabinet decision, but if Omicron were to get into the community in the next couple of weeks, what would your initial instinct be around the phased border reopening from the middle of January to Kiwis in Australia, middle of February to Kiwis and New Zealand residents further afield? I mean, what would be your thinking on a public health level about that at this stage?
Well, I think that our thinking about this is not necessarily linked to Omicron getting into the community. It's really more about what's happening in Australia. And we've seen in New South Wales this very big and quite rapid increase in case numbers. And the Prime Minister on Monday has already hinted that actually this is something we are going to keep under review. She said it will be formally reviewed by ministers in early January. I can tell you we're looking at it every day, and I think most New Zealanders are as well, because I know there are a lot of people with travel plans. At the moment, our intention is, of course, to keep Omicron out of New Zealand, and any decisions or changes around the starting up the what you might call managed isolation-free travel with Australia, scheduled for mid-January. No decisions have been taken, but you can imagine it's just under active consideration. Yeah,
so in a way, I guess if Omicron arrives into the community in the next, if it is already here prior to the introduction, then the decision might be different to if we're trying to keep it out and then the border reopen. And that's not.
Yeah, it could be, except there are just a point to make here is, of course, our outbreak at the moment in New Zealand is from one incursion of the Delta variant of the virus. So it is, one incursion is materially different from 50 or 100, because each incursion sets off another potential chain of number of chains of transmission. And I guess we'll be looking at it on a case-by-case basis. But at the moment, and a lot of people are wondering about, would we use lockdowns again? Well, we're in the COVID protection framework. It's based on high vaccination, but there is still that option for using it that's in the framework to use localised lockdowns if necessary, regardless of whether it's Omicron or not.
Do you think that's likely?
It's just too hard to call. But the important thing here, and I was just reflecting on this in the last day or so, right through this pandemic, what's become really clear is you keep all your aces in your hand for as long as possible. And I think as others have said, we're in a really good position. We've got high vaccination rates, that's an ace. We've got tight borders still, that's an ace. We've got our contact tracing, testing, isolation system is another ace. And we've got our COVID protection framework. So the idea is to keep them all in our hand for as long as possible.
Actually, Bloomfield, thank you so much for joining us. It's been a long year, particularly the second half. Merry Christmas if we don't see you again before then.
Thanks very much, Luke. Really appreciate it.